Dear students, let me introduce myself. I'm Dr. Manoj Mathew, working as an assistant professor in the Department of Social Work at Kalinga University, Raipur. Today, we will be studied about applications of counseling. We know that counseling is an assistant. It is a services provided by a technician or a professional to sort out the issues of an individual. And as we know that HIV is a chronic illness, HIV and AIDS, HIV or AIDS is a chronic illness and it became a threatening problem in the society and it is widely spreading globally. And as we know that it is a non-curable diseases and once a person is infected by the HIV, he will be lose the immunity in slowly and has to be surrendered for the death. In this context, there are many misconceptions about the HIV and the terminologies. So, the recently new term has launched the counseling in the context of HIV. So, here as a counselor, what are the ways he is dealing with the HIV and HIV infected people? So, in this session, I am talking about the process of counseling. There are two phases the counseling has been conducted. First phase is pre-test of counseling, the phase 1, and the post-test of counseling. And as per the NACO, National AIDS Control Society, and WHO, they are maintained a standardized guidelines to treat a person with HIV infection. So these guidelines also have to be followed by all the healthcare practitioners as well the counselors too. So the aim of the pre-test counseling guidelines goes to make sure that the client has sufficient information to make an informed decision about having a HIV test. So the counselor has to teach or educate the client about the HIV test and information. The pre-test counseling goes to next, identify yourself and clarify your role. As a counselor, he has to be introduced to the client what his role and what he is going to do with the client. If it is appropriate, explain what counseling is and why it is done and what is the role of a counseling. State how much time is available for counseling. So, the people will be very panic and very stressed under situation while they infected and they will get a lot of social isolation, social stigma as well. So the counselor has to be mentioned how much time is necessary for the counseling. Reduce the client anxiety by having relaxed and calm manner. We have to be support. Maybe the counselor has to put a hand on the shoulder and has to say, don't worry, everything is clear, we are here. Establish why the client has come in the testing for the counseling. Maybe he come for the medical surgical procedure. They may come for the people will come for the HIV test for the various reasons, and we never judge all they are HIV infected. In many hospital cases, when the students are going for the international study for the abroad, when we are going for traveling, when we are going the South African, the East Asian countries, we need to go for the medication test. So what different about today that prompted him or her to come in? To establish a client understanding of the HIV AIDS, correct and misinformation and supply missing information, because most of the clients are coming to the counsel room with a bunch of bounded misinformation and myth about the HIV. So identify the client risk activities and try to establish whether he or she is in a window period or not. That means the client has to understand about the client. Assess the client understanding of what the test entails. Assess the client in understanding the test and what the result means. Discuss the personal implications of having test. What negative or positive result will mean in his or family significant other. Discuss the practical implication of having the test. What negative or positive result will mean to him or the terms of sexual relationship work situation, life insurance, or medical follow-up. So the counselor has to be completely secure the person who come for the test even and after too. Next, identify how the client will be protect his or her sexual partners in intervening. That means if the counselor notice that he have got infected through the sexual relationship or unprotected sexual relationship, then he has to be protect his partners too. To discuss the client what a negative result would mean to him. To coming and surrendering for the test is not a big factor, but the result will be happen two ways, negative ways and positive ways. If it is negative ways, what the way which it mean and what the way the counselor has to handle. Maybe sometimes the client will be get angry towards the counselor. You are giving a misinformation and the entire society saying that who the hell are you to, who the this kind of aggressive nature will be happen. So the counselor has to be expected these all things from the client. Discuss with the client what effect an intermediate result would have him on her. Explore how he or she can cope with the positive result. In unfortunately or fortunately, the client recognizes that he is a positive person. So how he has to be cope with the situation. The counselor should be aware on that. Explore the client coping mechanism and how he or cope with the crisis in the past. What family support does or he have? What other support? So the counselor has to be ensure about domestic support and social support to the client while he recognized as a positive one. Discuss who the client would tell about her result and with whom he will be share, whom it will be go with the society and who will be support. Explore the potential support from loved one, family and close friend. So the counselor and the social worker the multidisciplinary team has to be joined together and they have to be get them to acceptable way. Discuss who the client may contact with the wait list waiting for the result. Maybe always on this kind of test, the counselor will be do all the things with the presence of a bystander. HIV post-test counseling guidelines. So this session I'm talking about after the test. We will discuss about before test what are the guidelines has to be keep in mind by the counselor and the way he has to be react. In this session, inform the client about the result. So what is result? It is important that the result of the test, whether a positive or negative, is given in the person. Maybe the options will be in the form and the doctor, the laboratory test, they will be given a positive or negative. If it in positive way, it has to be informed in way. The result should be only given if the counselor has a proof or in the form of laboratory report. In front, him or her, it is important to two reasons. One is to avoid confusion or mix-up rising. Second, as a proof to the client who may wish to see the result in the written form. The client have all the right to see whatever the result is mentioned in the form. The next goes to, if it is in positive test result, what will happen? The feelings such as shock, anger, disbelief, guilt or the self-guilt and whatever will be happen. The second thing is a shock. Then people will become panic and shock. That anger, guiltiness about their past life, why they live in the society and why it happened. That in some certain kind of mental traumas and psychological issue will be happen. It's called depression, anxiety, stress, obsessive disorder and independent nature and they will be isolated in this nature and everything. And an intermediate test result. If the result is in between that, there is a confusion. Whether it is positive or negative or some more test has to be do it, then they will have a mixture of these all feelings. If it is finding in the both ways, identify what support the client has. So the counselor has to be ensure the top to bottom of a client to delivering the services. Finally, the counsel has to be, if it is in positive test, the counselor has to be plan for the interventions and make an appointment. In first appointment, the counsel has to be educate the client to not to become a too much less immunity in the life. So he has to be guided with the lifestyle, safer sex practices, use of the contraceptive devices, infection control at home and workplaces, and medical follow-up, health monitoring, prompt identification, treatment symptoms, and local support system. Local bodies are bodies are designed for the government setup to stop out this thing and the protection of the HIV people, and offer follow-up counseling and session appropriately and 48 hours after the post-test counseling sessions, and give the following handouts: leaflet on the safe sex, and leaflet on the condom user, and a telephonic number to the NACO, WHO, and the hotline services there itself. On this has to be do it on the first appointment. Second appointment has to be designed by the counselor on the repeat the information as not too much will be the remembered on the first session. Never give any kind of mental trauma by the asking a too much question. The client has to be relaxed in the first time. Secondly, encourage the client to ask the question. The counselor has to be checked whether the person is responding, whether the person is okay with that. Stress the need to be develop the support system and encourage the person to find out the peer groups and friends, circle group people, and enable them to adapt the society. Look at the problem solving and enable the client or act as a mediator in between the client and the society to sort out the issue, and discuss about the future perspective, future strategies, medical ways, psychological ways, and social ways. And while doing these all things, a person with HIV infection, he can become normal being in the society. He can be only seen as just as a normal common diseases or diseases, and he can enjoy the societal life in a healthy way and prosperous way. Thank you for my lecture. Thank you.